Hey guys, welcome and welcome back to another video. So guys, if you have not subscribed, kindly click that subscription button, like the video, share and comment. Okay, so today we want to talk about another topic that is so crucial, and this topic is, or this medical topic is, an autism or autism spectrum disorder. So let's see what is it, or let's define it. Let us look at the signs and symptoms. Let us look at how it can be managed and what causes it, and how does it affect children living with this condition. How does this condition affect children that has this condition? So autism spectrum disorder, or autism, is a series of neurodevelopmental disorder that impairs a child's ability to communicate and interact with others. It is also include restrictive, repetitive behaviors, interests and activities, and these issues causes a significant impairment in social, occupational and other areas of functioning. And remember, I've just said that it is a series or a serious disorder of neurodevelopmental, it is a serious neurodevelopmental disorder. A serious neurodevelopmental disorder that impair a child's ability to interact and communicate. So we are going to look at, okay, if you just hear the word neurodevelopmental or neuro, the word neuro means brain. So we are going to look at some of these conditions. I'm just going to highlight some of the conditions that are under neurodevelopmental disorder, because it is disorders. This is one of the disorder under neurodevelopmental disorders. So let us look at that. I'm going just to highlight them and make some clarification on that. So neurodevelopmental disorders are types of disorders that influences how the brain functions and alter neurological development, causing difficulty in social, cognitive, emotional functioning. And these disorders, or this type of disorder, or there are many different types of this neurodevelopmental disorder, and number one is attention deficit. Attention deficit, you might give birth to a child who does not pay any little attention to anything in class. He or she is up and down everywhere. She's all over making trouble. That is attention deficit. We have this one that we are going to talk about, that is autism spectrum disorder. We are going to talk about that today. And also we have cerebral palsy, which also is common, and we have a video on that. You can go and watch it. We have communication disorder. There are some children who have problem with communication. We have conduct disorder. These people, they don't behave. We have intellectual disability. They can't grasp anything. Most of these children, they are always they can do craft work, but things to do with something that can challenge their mind or their brain, no. We have those are learning disorder. They can't learn anything, they're just there. And then also we have neurodevelopmental motor disorder. So those are some of the conditions under neurodevelopmental disorder, and we're going to look at only autism in this video. So remember I said neurodevelopmental disorder are types of disorder that influence how the brain function. So these people, this specific condition, this autism, this person or this child will have problem with communication and interaction with others. And nowadays we have seen so many cases of autism, and I think people have accepted, and most parents are coming out to show, to create awareness, and also to show how the challenges they are facing with this kind of children, so that in case you have such type of a child, or if you have that kind of a child, you don't restrict her or him from interacting with others, or you don't restrict her from learning, because they also take time to learn. In this video we are going to look at some of the severity of this autism, because we have the mild, the moderate, and severe. You find others can communicate, others can interact with others well, but they don't have even facial expression. We have the how this condition affect. We're going to look at how this condition affect interaction and communication with of the child. Yes. So we have found that the number of children diagnosed with this autism spectrum disorder is rising, and it is not clear whether it is due to better detection and reporting, or there is a real difference. There is maybe there is a real increase in this in the number, or both. Yeah. So while there are no cure for autism disorder, intensive early treatment can make a big difference in the lives of many children who are having autism. So let us look at signs and symptoms of autism. So we have seen that there is a problem with two things: social communication and interaction, and also repetitive in behavior, or patterns of behavior. So under this social communication and interaction, the child may fail to respond in his the child may fail to respond to his name, or appear not to hear you at any time. You call the child by his name, the child cannot respond. You know, when you are pregnant, and maybe you have the name of the child when you are pregnant, or you gave the child the name before she or he was born, and let's say that maybe during that pregnancy period you used to call the child with the name. When this child will be born, you find that he or she will respond to his name or her name so faster. But in autism, this child at 1 year cannot respond to his name or her name. If you call her by his name or her name, they cannot respond. Another sign is resisting cuddling and holding, and seems to prefer playing alone. Then retreat in they retreat into his own or on his own, or on their own world. This child will, because they have problem with communication, they will find hard time with playing with other children. You will find that this child is just alone, playing alone. They can she or this child cannot play with the kids, with the other siblings. Yeah. Another sign is it has poor eye contact and lack facial expression. When a child is born, you can see the child can smile within a period of what? The child starts smiling at 8 weeks. If you call her name or his name and you play with her, she will smile. And communication or this response continue to develop as the child grow. And you find in autism, this child doesn't have any facial expression. You call her name, you call his name, she just look at you, she doesn't respond, they don't understand. So that is another sign. The child doesn't speak or has delayed speech or may lose previous ability to say words or sentences. This child, when the child is about, the child start communicating when he is, or when the child is 8 weeks. Yes, 8 weeks the child can respond to sounds. The child can respond to communication. If you communicate with the child, you can see the child smiling. The child will start making sound step by step as the child grow. 3 months the child can laugh, not laugh, but you can see the a bigger smile. The child can cry when there is a problem. Yeah, the child, in short, the child can interact with you even if he or she doesn't have understand a lot of things. But in autism, no speech of communication. At 5 years we can't communicate. If you communicate, the child look like they don't understand or they don't know what to respond. Yeah, that is it. Also, there can be delay in speech. There can be delay in speech, whereby you get that at the age of 3 years, the child cannot still make statement or make a child of if a child has a good milestone. Of course, we know those those children who are having, how do you say, faster milestone or what, they can they grow fast, or they develop fast, they develop speech fast, they start working at early age, they start learning a lot of things at early age. Yeah, but with this autism, 5 years the child cannot communicate. That is one of the sign. So you should go and see the doctor at that point. Also, you another sign is that they may repeat words or phrases, or make some funny sound. You find that a child is just there. If you tell her come, she will repeat whatever you are saying. You make statement, they repeat that several times. Another sign is that the child doesn't appear to understand simple question or direction. Like when the child is still growing and the child is still very at that tender age, if you tell the child, please come, they can respond, go, take this. But in autism, they simply don't understand anything or direction. Another thing is that they don't express emotions or feeling or appear unaware of any feelings. When you laugh, or when you play with them, you want them to smile for you, they can't. When they are sad, you can't know. There is no expressions of emotions. And also, the child doesn't point or bring objects to share the interest. Yes, and another thing is that there is inappropriate approaches of social interaction by being passive, aggressive, or disruptive. That is under communication and interaction. Now let's look at the signs and symptoms under patterns of behavior. So we said we have they perform repetitive movement such as rocking, hand flapping, and also they develop specific routine or rituals and become disturbed at the slight change. You can find that this child just stand somewhere and do some funny things, and if you interact them, they feel disturbed or they get stressed. Also, they can have some constant movement. You find the child is just rotating maybe a dining table in the house. It is not a psychiatric disorder, it is an autism. Also, another thing that may happen, they may become fixed on an object or activity with abnormal focus. For example, you find that somebody was saying that the only thing that motivates, somebody was explaining somewhere that the only thing that motivates her autistic child, or yeah, is food. Without food, if you want this child to move, you just give her food or him food, she will move. That is what I mean by saying that. So also you might find that they prefer odd food preference. They have odd food preference, such as eating only a few food or eating only food with a certain texture. They might only want to eat maybe porridge or maybe soft food. The other food they don't eat. Yeah. Also, they does not engage in imitative or make believe or make believe play. Yeah, I think those are the signs and symptoms that are there. Another thing that I want to say is that most children with autism disorder are slow in gaining knowledge and skills, and some have signs of lower some have signs of lower than normal intelligence. Other children with autism have normal to high intelligence. They learn quickly, yet they have trouble with communication and play what they and what does what and have trouble with communication and applying what they know in everyday life, and adjusting to social situation is also hard. They have an exceptional skills in a specific area such as art, math, music. You can find that an autism has, they can sing very well. They can design something very well. Yeah. So when I want to say that as they mature, some children with autism become more engaged with others, and they may have fewer disturbance in behavior. Some usually those with least severe problem eventually may lead to normal or near normal lives, normal to near normal, because we said we have mild, moderate, severe. Yeah, you remember that. Others, however, continue to have difficulty with language or social skills, and the teen years can bring worse behavioral problem. So when do you have to see the doctor? When you realize all these signs are happening to your child. For example, the child doesn't respond to smiles, or they don't show any happy expression. Yeah, at 6 months the child cannot show any happy expression. Please go to the doctor so that you start training this child, because the more you delay, the more you will get trouble with starting to with communication. You will get trouble with living with this child. Also, a child just mimics sounds or facial expression by 9 months. 9 months a child should be making some sound that makes sense. Yes, mama, dada, bye, come. Yeah, things like those. If at 9 months the child cannot say bye, cannot say mama, can go to the hospital. Also doesn't babble or at 9 months. Another one, they don't say single words by 16 months. And also they don't play or pretend to play with others by 18 months. That is 2 years. Almost 2 years. Yes, almost 2 years. Doesn't say 2 words. They don't say 2 words in 2 years. please, in short, what I'm trying to say, you can see the doctor if you realize your child has the other signs and symptoms that we have mentioned. So what are the causes of autism? Autism disorder has no single known cause. Given the complexity of the disorder and the fact that the symptoms and the severity vary, there are probably many causes. Both genetic and environmental may play a role in the cause of this autism. So genetic problems, so let us look at that. So several different genes appear to be involved in autism spectrum disorder for some children. Autism spectrum disorder can be associated with genetic disorders such as Fragile X syndrome. Those ones I know you won't understand. For those genetic disorders, for others, let me say, for others, genetic changes may make a child more susceptible to autism spectrum disorder or create an environmental risk factor. So still other genes may affect the brain development or the way the brain cells communicate, or they may determine the severity of the symptoms. So some genetics problems seems to be inherited while others happen spontaneously. Yeah. Under environmental factors, research are currently exploring whether such factors such as viral infection, complication during pregnancy, or air pollutants play a role in triggering the autism spectrum disorder. So who is at risk? Yes, who is at risk of autism disorder? Your child's sex. So they are saying boys are about 4 times more likely to develop autism disorder than girls. And I can say most children I've seen with autism disorders were boys. Mostly they were boys. I swear if I've ever seen a girl, maybe I don't remember, but most of the children with this condition I've only seen boys. Family history is another risk factor. If you have a family member who had suffered from this condition, you might also give birth to a child who is having autism disorder. We have also other disorders. Children with certain medical condition have higher risk than other without these medical conditions. Okay, we have also parents' ages. If you give birth, they always say give birth when you are still young, when you are still below 35 years. Or let me say that when you are still below 40. So giving birth past 45 can put you at risk of giving birth to a child with an autism. Yes, those are the people who are at a risk. Also, another group of people are those people who give birth preterm babies born before 26 weeks of pregnancy may have greater risk of autism disorder because I think their brain has not developed well. Yeah, because you remember we said autism is a neurodevelopmental disorder that affects communication and social interaction. So there are no way to prevent autism spectrum disorder, but can be treated, and children can improve their language and social skills. So children with autism disorder typically continue to learn and compensate for problem throughout life, but most will continue to require some levels of support. So if your child is diagnosed with autism spectrum disorder, talk to expert about creating a treatment strategy. Keep in mind that you may need to try several different treatments before finding the best combination of therapy. Yeah. So I'm going to stop from there, and if you have any question you can ask it in the comment section about autism. I will answer it there. Yeah, so if you have not subscribed, kindly subscribe, like the video, share and comment. Let's meet in the next video.